and it's really good to be with folks based in the Waterloo, Kitchener-Waterloo region, because that's where I grew up. And still have ties because my family lives there. So I'm really appreciative of the opportunity to share some time and space with you this evening to um, yeah, collectively think about ways in which we can advance and our solidarity work from Turtle Island to Palestine. Um, I thought I would share an overview about the genocide in Gaza, and yeah, and just share some things and go into a little bit more depth that I think sometimes we don't have the opportunity to kind of understand some of the things that have really just happened over this for the past year and a bit. Because it just has felt like so much. But I'm glad that we're here thinking about this. Um, I've put here on the left, well, actually both maps are of the Gaza Strip. Um, and I don't know if you can you see my cursor? Yeah. So my cursor right now is at the Rafah border crossing. And that is where I entered with my fellow colleagues to work in central Rafah and also visit parts of Khan Yunis, which is kind of over here. This was in February of last year, so almost like over a year ago now, because we're at the end, almost at the end of January. Um, Over on the right shows actually where I worked. So this box in central Rafah is expanded over here, and you can see the Al Emirati Hospital. I stayed at this hospital because we actually didn't have accommodations, didn't really know where we are going to go. The additional context is because you actually don't see it on this map, but over here in Khan Yunis is Al Nasser Hospital. You don't see it on this map because there was no World Health Organization emergency medical team there, but it was surrounded by tanks, Israeli tanks, at the time when we entered Gaza, and we were actually supposed to work there, but it was totally inaccessible because people tried to, like the World Health Organization, the UN, tried to send teams. I remember they tried to even send like a mechanic to repair sewage that was overflowing into the emergency department. You can imagine how difficult it is to work in an emergency department when sewage is like literally overflowing into the work environment, the space that you're trying to take care of patients. And they were being denied access to even go repair that. During my stay in Gaza, the Al Nasser hospital was besieged by the Israeli forces. Healthcare workers were abducted and unlawfully detained. And later we discovered, a couple months later, there were mass graves around the Nasser Hospital medical complex um, with the bodies of like healthcare workers, including patients, in these mass graves. Um, but um, the Emirati hospital is where I stayed, and then later we worked at the Tal Al Sultan Clinic in Central Rafah. So that's primarily where I spent most of my time. You can see it's just like so close to the Egyptian border. And this was at a time when the majority of the population was actually all squeezed into Rafah. Approximately, like 1.4 million people were in this tiny space in all of the Gaza Strip in Rafah. Um, and on two occasions, we did go to the European Gaza Hospital in Khan Yunis, which is right here, a little bit farther north, just by a little bit. And this is where I'll show photos of where um, thousands of internally displaced families lived and resided in and around the hospital, including the stairwells, including the hallways of this hospital. Because there was a sense, I guess there still is a sense where there is a hospital or a clinic, it might be a safer place to be in Gaza, but we know from sustained attacks on healthcare, essentially all of the hospitals in Gaza have been attacked at some point during these past 15 months. Um, and later, the European Gaza hospital was forced to be evacuated by the Israeli forces as well, and basically became a ghost town. But I did visit this hospital, including visiting the intensive care unit of this hospital, and there were children who were fighting for their lives in the intensive care unit, having sustained gunshot wounds to the head and to the chest. These are well documented crimes against humanity by the Israeli forces, that healthcare workers, both in Gaza but also around the world, who have visited Gaza and have returned to their, wherever else they work, have documented these things and have been providing these testimonies to the International Criminal Court and the International Court of Justice, and to other mechanisms for legal accountability. I just want to share these infographics about the sustained attacks on healthcare. These are underestimates by the World Health Organization. So up until February of last year was when I entered, and so that's the figure on the left. And the most recent data is the graphic on the right. Just fairly recently, I wanted to put this in here because um, this was like days before the ceasefire was put in place, and I think a ceasefire is not an appropriate term because the Israeli forces, they have already um, uh, like breached the ceasefire by attacking both Palestinians in the Gaza Strip and also escalating their attacks on civilian life, Palestinian civilian life in the West Bank and Jenin, for example. Um, uh, the white spaces is somewhat where the like the majority of the population were pushed to, forcibly pushed, ethically cleansed too. And all of the red was what the reference, this is from the United Nations, what the United Nations deemed a military zone. But even within these white areas where the so-called humanitarian zone, um, there would be bombs dropped on like the vast majority, if not all of the people being internally displaced people, families, civilians living in tents. Many of these tents actually just made of materials that are wholly unsuited for the weather that they were experiencing. And so there were multiple cases of young babies, day-old babies, having died from hypothermia from the elements. But it's all part of the kind of genocidal apparatus that has allowed for these things to happen. This slide also mentions food insecurity. I remember even when I was there were no official reports of patients or children having died from severe malnutrition, but some of the patients that I saw were the sickest patients that I've ever seen in my medical career thus far. And the impacts of severe malnutrition because of forced starvation were so apparent that it was quite literally the tip of the iceberg, what I was seeing, because I was in Rafah when the reports from northern Gaza, where there were people uh, uh, using animal feed to make bread, to kind of eat anything. And I remember when I left Gaza in late February, that's when official reports came out that there were people who died from severe malnutrition for starvation. And unfortunately, that has continued. Um, these were some of the more hopeful images that I saw that I took with my camera, my phone camera, in Gaza in Rafah, where there are people, they also just continue to live their lives, like during genocide. And so I saw many children at times fly kites, sometimes with materials that they made, sometimes accompanied by adults. And it was just such a stark contrast of, I think, the joy and the hope from these children flying their kites, despite there also being bombings, airstrikes around us, or drones. Just the contrast of what you could see in these skies. I remember being at the primary healthcare clinic and looking up, and we were not sure if something was a kite or a drone at some point, but the children can always tell you, oh, that's a fighter jet, that's a drone. And it's always nice to know that there's a kite or two in the sky. These were very common things to see at the time in Rafah in February, where like almost like every other street that we drove down had a building completely demolished by an Israeli airstrike. Um, I haven't included in these slides the most recent images of Rafah, but you can look those up online. And essentially, it's been completely decimated and demolished when um, when we can even think back to all of these contradictions, or not contradictions, they were essentially just horrible lies. For example, I remember being in Rafah and the U.S. administration, the Biden administration said that if Israel were to enter and invade Rafah, they would cut off weapons, and they have done no such thing. But in this photo, I think it also shows the steadfastness and the stubbornness of the Palestinian people, the indigenous people of Palestine, that they resist in these different ways, including living where they previously lived, despite the building itself being completely like decimated and torn to the ground. You can see someone has built a tent to remain living here and to be there. These are photos from the inside of European Gaza Hospital in Eastern Khan Yunis. And you can see, like, if you've ever been in a hospital corridor, usually it's quite empty, but here, like, people have made like uh, little sections made up of blankets, made up of any materials that they could really just carry with them sometimes on their backs or in their hands. Folks have like left essentially all of their belongings and only the clothes on their back and the shoes on their feet when they are forcibly evacuated. And have made these kind of makeshift homes within the hospital and all around the hospital. These were, still the conditions up until the ceasefire, and now we have so many people return to their previous homes only to find, like, only to find like family members who have died, only to find the remains of their neighbors, so that they can give them a proper burial, and to also find completely demolished homes, buildings that they previously lived in. And so there's a responsibility, I think, for all of us to support the Palestinian people as they work to rebuild, but also challenge the existing systems that allowed for this to happen, including the illegal Israeli occupation. That is at the root of this senseless genocidal violence. These are pictures of, just a sample of some of the things that we brought in to Rafah through the Rafah border crossing. We brought in, I was with a team of three others, so the four of us brought in about 16 suitcases of medications, supplies that were so desperately needed in the clinics that we worked at. There were no antibiotics available at the clinics that we worked at, and so we essentially brought a supply and started to use them. But I think it's important to know that like these humanitarian efforts are also not the solution for a crumbling sovereign health system that was previously Palestinian led and now is being sectioned off by many different humanitarian organizations. And that sovereignty is being stripped away from the Palestinian people and the Palestinian healthcare workers as part of what colonialism does to an indigenous people. This, I just wanted to flag, and I'll read it out to you. One of the children I saw was the sickest child I had ever seen in my medical career, and I could wrap my index finger and my thumb entirely around both the upper arm and the lower leg of this child, and he was 9 to 10 years old. So this was one of the children, one of the patients that I saw at the primary care clinic, and was really a reflection of the blockade on the Gaza Strip to not allow in necessary humanitarian aid, food, water. This a blockade on the Gaza Strip has actually existed for 17 years, but was also tightened when this overt genocide escalated from the Israeli forces in response to an act of indigenous Palestinian resistance to their colonization. So you saw where I worked in Central Rafah. This was in May when I was trying to re-enter Gaza, and I'll explain a little bit more about that, May of last year. But my colleague here also knew this clinic and worked at it. So she says, the Med Global Primary Health Clinic had to be relocated due to increasing hostilities. Currently, the former clinic is being used as a morgue because there's nowhere to place the increasing number of dead bodies. Health facilities are being used as morgues instead of a place to provide care. Let that sink in. So I just remember seeing this image and immediately recognizing it as one of the clinics that I worked at. It's called a Med Global Primary Health Clinic, and it was tacked on to the Tal Al Sultan Primary Health Clinic in Central Rafah. And so these dead bodies were from the multiple Al Mawasi tent massacres that took place in May. And it was just awful to see the clinic turn into a morgue. And in May, when I was trying to re-enter Gaza through the Rafah border, if you might recall, this was when the Israeli forces actually forcibly seized and destroyed and occupied the Rafah border crossing. It is still not open to this day. Part of the ceasefire agreement is that it will reopen. But essentially, there was no movement for anyone for about, I think, a week and a half, or 2 weeks. And then later, things restarted through the Kerem Abu Salem crossing, which I'll show you is here. I don't know if you can see my tiny cursor. It's on the map, Kerem Shalom crossing. This is the Israeli term or name for the crossing that erases its indigenous name, which is the Kerem Abu Salem crossing. And in May, this crossing was used to allow the flow of humanitarian workers. The important thing, I think, to recognize is that it does not border Kerem Abu Salem. This border with Gaza and and Israel. It's not like the Rafah border, which borders with Egypt. There was no Israeli military presence at the Rafah border crossing until it was forcibly seized, occupied, and later destroyed. But the Kerem Abu Salem crossing is in full Israeli control. And because of that, the Israeli military implemented additional restrictions, including the amount of people coming through and also what they could bring with them. And so the ways in which we brought in medical supplies through the Rafah border became something in the history books. When the operations really went through the Kerem Abu Salem crossing in mid-May of last year, healthcare workers were only allowed to bring in personal items. One like bag, like one kind of like it's kind of like it was like airport restrictions essentially, like including fluids. Like fluids had to be as under like 100 cc's or milliliters, and so even medications, if you're going to bring in medications, it had to be for personal use. So this further restricted what was already entering, which was absolutely insufficient for, a population of like 2 million people. It's actually kind of like a facade of humanitarian work, essentially. Hence why many international organizations, including Amnesty International, Human Rights Watch, Médecins Sans Frontières, the Lemkin Institute, International Court of Justice, have deemed what is happening in Gaza as genocide. In August of last year, myself and many other healthcare workers who were based in Canada, who had seen firsthand what they did in Gaza as genocide, wrote a letter together to end Canadian complicity in the ongoing genocide, including, demanding for the lifting of the blockade, that neutral agencies should conduct the background checks and not Israel, a party of the war, of the conflict, of the genocide. To ensure unrestricted access to medical and surgical equipment and the blockade, to comply with the ICJ decisions, which really means like important things that Canada is legally obligated to do, and which is should withhold all military and economic aid to Israel. And Canada was not doing that. There still are, and there were companies that are based in Canada that have export permits approved by Canada, which are still being honored, to allow military equipment and supplies that go into making the F-35 fighter jets that are built in the United States and sent to Israel, to be used in Gaza to drop the 2,000 pound bombs on civilian life. And absolutely, in keeping with that, enact a two-way arms embargo. Important to note is that that letter went completely ignored. We have also organized press conferences around that letter, and the Canadian government has completely ignored like absolutely no reply to our letter. Um, uh, Fast forward to January this month, myself and many others wrote this report to the United Nations Special Rapporteur for the Right to Health, titled Healthcare Workers as Human Rights Defenders, a Medical Perspective on Israel's Genocide, Enablement Apparatus in Gaza and Abroad. And in short, we really wanted to highlight the attacks, the systematic and deliberate attacks on healthcare in Gaza, um, but also the silencing and suppression of healthcare workers all around the world, including in Gaza, as part of that apparatus that allows for the genocide to continue. The most egregious and overt way in which silencing and suppression happens, for example, in Gaza, is over 1,000 healthcare workers have been brutally killed by the Israeli forces. Um, some of whom have died because they've been tortured, raped to death in Israeli torture camps. Um, and we still have over 450 healthcare workers who are abducted, held as hostage in these Israeli torture camps, including Dr. Hussam Abu Safia, who is the medical director for the Kamal Adwan Hospital in northern Gaza. I remember being on a call with him last month, and he was thanking us for the work that we're all doing in trying to end Canada's complicity in the genocide. And his whereabouts, the exact whereabouts are not well known. We know that he's been being held by the Israeli forces in a torture camp, essentially. Um, but the other ways in which the silencing and suppression happen is through like disciplinary action, through a administrative body, through a workplace. We have healthcare workers that have lost their jobs, have been suspended, have been, disciplined in all these different ways. And we have to understand that these forms of anti-Palestinian racism to dehumanize, delegitimize the ways in which healthcare workers around the world have been in solidarity with Palestine and Palestinians to do the most dutiful and moral thing to do what we can to end this genocide. Those acts of suppression and silencing and repression must be understood as part of the genocidal enablement apparatus that allows for genocide to happen. None of this is by accident. It is all by design. Um, this report will be, so that was just the executive summary where we talk about the Israel's genocide enablement apparatus, the cumulative impact on the Gazan healthcare system, reprisals and repression in Western institutions, the medical definition of genocide, and healthcare workers as human rights defenders. The full report will be launched in about a week on January 29th, and we'll have the United Nations Special Rapporteur to the occupied Palestinian territories, as well as the UN Special Rapporteur to the Right to Health be present as well. And I put the link to register for that virtual press conference there. I can share the slides with you all afterwards. I mentioned Dr. Hussam Abu Safia. He is one of over 450 healthcare workers who still remain abducted in these torture camps by Israel. This is actually out of date. It's from like 4 days ago, I think. It's almost 4 weeks since Dr. Sam Abu Safia has been abducted. Many other doctors, nurses, healthcare workers are in these positions. There are healthcare workers from other hospitals like Al Shifa Hospital, like Al Nasser Hospital, who stayed back to take care of their patients. And they got abducted, and their whereabouts are completely unknown for many, many months, some since the start of this escalation in October of 2023. And so many of these healthcare workers, we do not know if they are still alive or they have died in these torture camps, or if they are buried in the mass graves around the hospitals. I wanted to end with a reflection on just like the immense like love that I was greeted by from the Palestinian healthcare workers that received us, the children that were always so grateful to ask me what's my name, and share the things that they wanted to share with me. I remember like this little one next to me in this photo. He would always be at the clinic and would share like songs on his phone that he was listening to with me, and just the immense like gratitude that the Palestinian people that received me. Yeah, I'm just like so immensely grateful that I had an opportunity to bear witness to their ability to care for one another, to maintain hope and joy when despair is so easy to fall into. Um, and uh, and like they wanted to do so much more for us, like cook proper meals with us, show us the parts of Gaza that they loved, and they felt you know uh, ashamed that they couldn't be like the the hosts that they wanted to be for us as guests of their land. Um, and like the only hot meals that I ate, for example, in Gaza were with Palestinian healthcare workers that demanded that we share their food. And it was, both so heartwarming, but also like soul shattering, to like hold these contradictions of knowing how little that they had, and what a privilege it was for me to visit and also to exit, having lived knowing the realities that they still continue to endure under these genocidal conditions. Um, uh, and I will share with you that I believe that Gaza has taught the world that decolonization is not just a metaphor. To resist colonization and colonial erasure is to struggle for self-determination and liberation from oppression. It is rooted in a deep love for their people and land, for life and dignity. And because of that, Gaza teaches life. And I, as someone who's benefited from the essentially stolen land, like land that hasn't, like treaty land that hasn't been respected or upheld here on Turtle Island, knowing about the genocide of Indigenous peoples, First Nations, Inuit, Métis here on this land, I have spent much of my like career in medicine and public health, understanding the like impacts of colonialism on health and healthcare. And that is how I understand Palestine. That is how I understand Indigenous health in so-called Canada. And so I wrote this piece on how Palestine is freeing us all before Palestine is free. This is my last slide. I started with a few other amazing people here in Ottawa, also known as unceded, unsurrendered Algonquin Anishinaabe territory. Um, a political education collective to really help all of us kind of sharpen our political analysis on Palestine because we uh, like found each other within the Palestine organizing space, but we also know that collective liberation includes many different issues, many different things that are happening within our own communities and backyards, where the impacts of capitalism, colonialism, imperialism are also felt by communities here at home. So we thought to build a popular education collective so that we can disseminate popular education to help understand things that I think people are really grappling with, including like Canadian complicity in Israeli apartheid. So that was one of our first events. It was our first public event in December last year. And we've created educational materials that you can find on our Instagram, Education for Liberation, where we really hopefully give you some concrete ways in which Canada's values of colonialism, imperialism, and capitalism are in keeping with Israel's values being the same ones. And that is why Canada does what it does at the federal government level, at many other institutions, for example, that refuse to divest, that refuse to move away from supporting the or being complicit in the military and war industrial complex because it is profitable, because it aligns with their existing interests and values. And so better understanding that allows us to get closer to how to address those root causes of disease and suffering around the world, including here as well. And so there's also a resource on collective strategic actions to challenge Canadian complicity in Israeli apartheid. And I think the way forward is through community, is through collective action. It is not enough to bear witness. We actually need to work together to dismantle these systems of oppression that unfortunately we are so steeped in being in the belly of the beast of one of these imperial nation states that continues to do what it's doing to oppress people around the world, but also is doing the same to oppress communities here at home, knowing that Canada, as a settler colonial state, has historically an ongoing uh, oppressed Indigenous First Nations and Inuit Métis peoples. And so maybe with that, I will finish and appreciate everything that you're doing to end Canadian complicity in Israeli apartheid, occupation, and genocide. It is only through all of our collective efforts that we also stay sane and grounded and not gaslit by all of these oppressive institutions, the mainstream media, our workplaces that want to uphold the status quo when it's exactly that is not working for so many people in this world, especially as I think I've been reflecting on the far right fascist movement that is really not even just growing, but is like put into the mainstream just south of Canada and the United States. And so we really are in a moment of intense need for community, for collective organizing, so that we can get through these like horrible moments of fighting far right, white supremacist, fascist movements that at the part of it is what is happening in Palestine, and then is what is really going to unfold in Canada and the US over these next few years, and unfortunately probably for many years ahead. But it is only through these kinds of conversations, this kind of work, that we will get through it. I'm sorry, I think I went way over time. I will finish. Thank you.